Baclofen. Let's talk about this medication. Now, remember, a lot of people take this medication, and a lot of people are not take this medication. Now, when we talk about the medication baclofen, we are not talking about the simple muscle relaxant for sore muscles. Now, remember, baclofen is used for spasticity caused by neurologic disease. It is very important. These are things like spinal cord injury, multiple sclerosis, stroke, cerebral palsy. Now, remember, in this patient, the muscle is tight because the nervous system is overfiring. This is not because the muscle itself is injured. It is very important. Now, baclofen works mainly in our spinal cord. It stimulates something called the GABA B receptors. Now, these are inhibitory receptors. Remember, when these receptors are activated, they reduce something called the excessive nerve signals going into our muscles. Now, this lowers the reflex activity and it decreases involuntary muscle contractions. Now, that's why baclofen helps with chronic stiffness and spasms. This medication is not very useful for simple muscle strain or acute back pain. Now, after oral dosing, baclofen is absorbed well and cleared mostly by our kidneys, not our liver. It is very important. Now, this means patients with reduced kidney function can accumulate the drug and develop toxicity if doses are not adjusted very well. And in severe spasticity, baclofen may be delivered directly into our spinal fluid using the intrathecal pump. This allows strong spinal effects with the lower overall doses. Now, because baclofen slows the central nervous system, side effects are common and also they are predictable. The most frequent ones are the drowsiness, the dizziness, the fatigue, the generalized muscle weakness. Also, patients may often say they feel foggy. Sometimes these patients say they feel less alert. Now, it is very important. You may also see some low muscle tone, nausea, constipation, dry mouth, headache, urinary retention. These are very important. Now, at higher doses, baclofen can cause confusion. At higher doses, baclofen can cause low blood pressure. Also, it can cause slowed breathing. It is very important now, especially in older adults, baclofen can cause slower breathing. We need to pay attention to that. Now, one of the most important safety issues with baclofen is the withdrawal part. Baclofen will cause some withdrawals. Now, remember, baclofen must never be stopped abruptly or suddenly. Abrupt discontinuation can lead to severe rebound muscle rigidity, agitations, hallucinations, muscle breakdown, high fever, seizures. It is very important. These can become life-threatening. This risk is highest with the intrathecal